Hello, my name is Sara Reid, and I'm the lead nurse in Stomi care at Ashford and St Peter Hospital in Surrey, the United Kingdom. Thank you for inviting me to speak at the study day. Get It Right First Time is a UK initiative designed to improve quality of care within the National Health Service by reducing unwarranted variations. Its principles can have implications for all services within the NHS. So what does this mean? UK healthcare is provided by a single payer, that's the government, and it's funded by the taxpayer. It's deemed to be free at the point of access, but important to remember that our taxes do pay for this. We work with a devolved government where our central government gives a cash sum to Wales, Scotland and Northern Ireland for their government to manage their own health service. The presentation today revolves around NHS England initiatives. The English National Health Service is controlled by a central government through the Department of Health and Social Care, who have responsibility for the service. Under the proposed budget for 2020 to 21, the total spend will be around about 147.1 billion. Healthcare is expensive and needs to be efficient. It needs to be cost effective and patient focused, and getting it right first time is imperative. Get It Right First Time is an NHS improvement programme and was first developed by an orthopaedic team in conjunction with a partnership with the Royal National Orthopaedic Hospital. It first developed through the orthopaedic team when they wanted to reduce the unwarranted variations in their own practice. And this would streamline their services, improve their outcomes and quality of life, and reduce the cost, adding value to the patient's journey. It still enables recognition, though, of some variations being inevitable, as in local needs and priorities of population and shape of the service are still required. It aims to identify and challenge practice and to improve care and efficiency. This is done by reducing the unwarranted variation and improves the patient outcome, service cost and overall productivity of the National Health Service. It is a very respected process within the NHS as it's led by frontline clinicians who are experts in their field. They have knowledge of the difficulties faced in the health service and of the constraints around it. They engage with their peers and have shared goals to improve the National Health Service outcome, efficiency and cost savings. The process is in-depth. It starts with the collection of data that's analysed by the lead clinician, who then attends the National Health Service Trust that's being reviewed. They look at the number of factors that will influence care, and these are taken into consideration, e.g. the length of stay, the mortality, and the overall budget that's been allocated to the service pathway that they're assessing. Once the information is collated, they produce a report, and once the report has been seen by the Trust, they then visit, and this is known as the deep dive. During the deep dive, all of the multidisciplinary teams that have been involved in the pathway are invited to attend, and this is a very important process. So we have consultants through to the clerical staff and nursing staff all in attendance and being represented. This gives them the opportunity to discuss the challenges that they face and also around their individual practice in that pathway. It gives us the opportunity to share best practice and to discuss solutions that have already reduced variations in other trusts. After the review, which will include a minimum of 40 trusts, the lead clinician will oversee a report into the speciality that's being reviewed. The findings are documented, examples of best practice are given, and action plans for proposed changes and improvements are given. The action plan is detailed evidence of the benefits that the changes will bring and are supported by the Get It Right First Time programme. This means that the programme will be supported. We don't just receive the report and then it's finished. The clinician will support, and the Get It Right First Time programme will support us with implementing those changes. Within my trust, the strategy document for 2018 to 2023 recognises that we are already an efficient NHS trust. The aim of within this strategy is to standardise and eliminate unwarranted variation in the delivery and outcome of clinical services. The Get It Right First Time is included in the 5-year plan and is recognised for its value in promoting outstanding cost-effective care. Standardisation approach is embedded in the Get It Right First Time programme. We've been involved in a couple of the projects that have been implemented through the Get It Right First Time. One of those was the surgical site infection programme. We noted that we had a high rate of infection sites, and this was in the past deemed to be acceptable because we were colorectal surgery, and colorectal surgery seemed to be a dirty surgery where you would expect to see a high rate of infection. However, this is challenged and was not the case in other trusts, and through this assessment and this review by Get It Right First Time, our patients now, when they return from theatre, will have a negative pressure wound therapy dressing. This is known as a PICO, and this is covered over the wound to reduce our rate of infections, and we are seeing progress with this. The other engagement that we've had with Get It Right First Time is that we now cover our on-call with 24-hour consultant review. So patients that are admitted to the trust are actually seen within the first 24 hours. And we also have consultant of the week. And that means that all senior ward review is done with a consultant. And this enables for decisions to be made quickly. And if the patient is not to progress to surgery and it's an unwarranted care, then they will be discharged. Obviously, this frees up capacity within the service. We've had major investment into our emergency surgical ambulatory care unit, ESAC, and also to our surgical assessment unit. Patients can be referred directly by their general practitioner, via our department, for review by a senior member of the team. We can get scans, bloods, all done within a certain amount of time, which will prevent the patient having an unnecessary admission through the A&E department. This improves their outcome, it reduces their length of stay, and it means that we do most of our management for those patients back out into the community, which is where they should be. Within my practice, having a stoma can be a life-changing for an individual, and this is recognised by all. The specialist nurse that I am today is very different to the specialist nurse of 25 years ago. Surgery has evolved, products have improved, and patients' expectations of the NHS, me, and my service have changed dramatically. The patient from my early career learned with me, and I didn't always get it right first time, although that was my aim. Learning through experience can sometimes be a frustrating, lonely place, and has a psychological impact on the patient. As the service evolved, so did the NHS, rapidly becoming a cost, outcome, and patient experience focused service. We have had to change our practice and work smart. As our team evolved and people retired, I've become lead for the team, and I now have juniors working within the service. Whereas in the past, we all did what we did and we knew what we knew and it wasn't challenged, this has now changed. They've made me stop and think about why I do what I do. They ask me questions. How did you know that that bag would be okay? Why have you chosen that product? What can I use on this? Will I ever be as confident as you? And this has made me stop and think about the knowledge that I have. How can I use that knowledge and how can I pass it on to my junior colleagues to enable them to get it right first time without having to learn through experience? I'd like you to look at this slide and to write on your paper 3 words that you would use to describe this stoma. It's an early post-op stoma, as you can see by the surrounding skin and by the sutures that are still there. But have a think about it and just on your paper write down 3 words. I was invited to be part of an expert group to achieve consensus-based practice guidelines. We met to determine objectives, study questions, and how to achieve this, supported by a facilitator and a lead medical specialist. We wanted to adopt a collaborative approach to development of guidelines, so the nurses involved felt included in the process and ownership of the guidelines when completed. This reflects the philosophy around get it right first time for the medical practice. It will gain respect when working with your peers if they feel listened to, involved in the process, and able to have an opinion. So how did we achieve this when we did it? We used a consensus process. Consensus decision making is a creative and dynamic way of reaching an agreement between all members of a group. Using the consensus shows a commitment to finding a solution that all will feel actively supported by. And instead of it being a show of hands that you go with the majority, it enabled us to ask questions and to gain information and feel that and give those nurses empowerment that they felt included. The modified Delphi approach enabled us to have this approach to our work, enabled us to redefine questions and gather results from large groups. The estimation is that 1,200 nurses answered one or more of the Delphi questionnaires, and more than 960 nurses were involved in the face-to-face questionnaire at the ostomy days. This inclusive collaborative process was effective and produced informed guidelines. Respondents to the Delphi process clearly understood and engaged with the process, knowing that the benefit that they would receive from the guidelines that focused on quality of life and outcomes around getting it right first time. So the outcomes for the project: development of the body profiling assessment tool is evidence-based, enables others to get it right first time without having to learn through experience, and the impact that this can have on a patient. Get it right first time is empowering for nurses and patients. Patients understand the rationale for the clients chosen and feel included and empowered in the decision making about their care. It gives us a comprehensive record of why we've chosen that can be attached into the patient's notes. So when things change in response to their general well-being, we have a reflective piece of work that we can look back on and reevaluate for that patient. It provides cost-effective care. Choosing the correct product gives us a reduction in waste and the use of accessories. And it improves the quality of life for the patient, and this is immeasurable. Now, if you go back to the slide that we spoke about, and I asked you to write down the 3 words, I actually did this with my own team. And at the beginning, we did have very different words, all meaning the same thing, but it did demonstrate to us that there was a variation in our language. It also gave us the opportunity to look at the products that were available and the body type, and to teach with the junior members of team about correct selection of product for a patient. Traditionally in the past, it was always deemed that we should be using a flat product and working out from there. The impact on using the incorrect product on a patient and their psychological well-being is immense. If you can get the product right first time and give the patient comfort and confidence, they progress well through their journey. Through the body profiling, that has helped us to achieve this. And when we measured this within our own department for the nursing staff, they were able to choose the right product with the consensus guidelines. The British Journal of Nursing have published the consensus guidelines, and it's also being produced in 2 other countries. The body assessment tool is being used by over 2,000 nurses in 27 countries, and this can only benefit the outcome for our patients and for the service that they use. Getting it right first time. Using consensus guidelines improves quality of life, is cost-effective and evidence-based. Getting it right first time is the aim of all healthcare professions, but standardising our practice and reducing variations will enable us to demonstrate the value our decisions have on the quality of life for all of our patients. Thank you.